At last year's Hack for Health, we had the opportunity of engaging with patients suffering from multiple sclerosis and Alzheimer's disease. During our interactions, they kept referring to the fear of developing bed sores, an injury on the skin and the underlying tissue as a result of immobility. This silent epidemic affects 3 million patients in North America. It's classified as the #1 hospital-induced illness. The cost to treat one bed sore costs upwards of $130,000. Legally, they represent the second most medically filed lawsuits, leading towards an annual expenditure of $15 billion in North America. 1 in 4 Ontario patients are affected by bed sores. And if you still think this problem isn't that big, 7 people die every hour. Once our team knew what the problem was, we then went to geriatric care units, long-term care institutions, and hospitals to understand why the problem exists. And what we found was alarming. We found that manual redistribution and visual inspection, which physically requires a nurse to move a patient, are still methods being used to prevent this illness. As you can all imagine, this is highly problematic and ineffective due to the overburdened healthcare system. Furthermore, the way bed sore data is collected and transferred is complex and outdated, which adds on to the inefficiencies. So we needed to develop a solution that would enhance the quality of life, improve communication channels, result in effective management, and lead towards cost efficiency. Presenting Ceylon Systems by Curiato. Our patent-pending approach is a combination of a smart mattress that actively detects pressure, thermal, and humidity, the 3 most critical factors when determining a bed sore. This information is then used to automatically relieve pressure at areas of high risk. The information is then transferred to our patient management interface, where the data is stored, analyzed, and visualized to present dynamic scheduling, vital care notifications, and real-time analysis, streamlining, simplifying, and automating the entire process of bed sore management. The fast-growing North American market for bed sores is worth $7 billion, with the serviceable available market being more than 50% of the total market. Since our inception at last year's Hack for Health, we've come a long way in understanding the depth of the problem and researching and developing a solution to tackle this big problem. Along the way, we won numerous awards and recognition, which allowed us to secure our first clinical studies with Toronto Grace Health Centre starting June of 2017. This would have not been possible without our amazing team, who are the cornerstones and pillars of this company, bringing expertise ranging from software and product design to artificial intelligence and cloud computing. Our brilliant advisors have helped us every step of the way, from validating our technological claims and redefining our business model as we progressed. Lastly, no one, absolutely no one deserves to die of an illness that's preventable. We have the team, the capabilities, and the expertise of preventing the #1 hospital-induced illness. We are Curiato, and we are preventing bed sores.